Hello everyone, welcome to my YouTube channel Tooth Talks. In this video, we'll be discussing some important topics for BDS first year professional exams for anatomy. Note is that diagrams are mandatory for anatomy exam no matter what the question is, but we have to make a neat and clean diagram. Our first topic is about mandible. Mandible includes many questions like features, example about ramus, body, coronoid process, condyle process. So we have to write a neat answer. Then the nerves and blood vessels, age changes according to mandible, then movements of mandible. Then coming to our next topic, that is scalp. Scalp is an overall important topic. It includes layers of scalp with diagram, innervations like arterial supply, venous drainage, lymphatic drainage, then dangerous area of scalp, and then black eye. Face is also an important topic. It includes nerve supply, both sensory and motor, arterial supply, venous drainage, which includes retromandibular vein, then lymphatic drainage. Again, dangerous area of face, then buccinator muscle, its origin, insertion, nerve supply and anatomy, facial palsy and Bell's palsy, and then intracranial course of facial nerve. For orbit, lacrimal apparatus and its nerve supply, choroid tympani nerve, extraocular and intraocular muscle, it is very important, and then oculomotor nerve. Then side of neck, it includes investing layer of neck, carotid sheath, boundaries and content of posterior triangle of neck, and then sternocleidomastoid muscle, and again its origin, insertion, nerve and blood supply, and then its applied anatomy. For anterior triangle of neck, the carotid triangle, its boundaries and content, digastric triangle, ansa cervicalis, external carotid artery, its branches, diagram, then lingual artery and infrahead muscle. These all are important. For parotid region, the anatomy of parotid gland, which should include its features, structures lies within parotid gland, its relation, blood supply, applied anatomy are important, and then the parotid duct. For temporal and infratemporal region, muscle of mastication, which is very important, then maxillary artery and nerve, mandibular nerve again important, then lingual nerve. And for TMJ, you have to write in various topics like ligament, then its relation, blood supply, and then movements. These all are important for TMJ. For submandibular region, digastric muscle, mylohyoid muscle, hyoglossus muscle, and then submandibular salivary gland, which should include its deep relation, its superficial relations, its innervations, and then some muscles like genioglossus, mylohyoid, buccinator, and sternocleidomastoid muscles. Then, for structures present in the neck, thyroid gland, internal jugular vein, glossopharyngeal nerve, and then hypoglossal nerve. These are all important. Then for the prevertebral and paravertebral region, atlantoaxial joints, vertebral artery and phrenic nerve. These all are less important like other content. So the next up is the cranial cavity, fox cerebri. It is very important. Cavernous sinus with diagram. It's very important. It should be written with its boundaries, content, communication, tributaries, then pituitary gland, Rathke's pause, internal carotid artery, and trigeminal ganglion. Then mouth and pharynx, muscles of palate, hard palate, soft palate, Waldeyer rings, important. Then palatine tonsil, tonsillar bed, then muscles of pharynx, and then structures or parts of pharynx are important. For nose and paranasal sinuses, nasal septum, it's very important. Then maxillary sinus is important other than other paranasal sinuses. Then lateral wall of nose and openings in lateral wall of nose are important. For larynx, its cartilage and nerve supply is important, and tongue is an overall important topic which includes innervations, lymphatic drainage, muscles of tongue, its anatomy, its development. Next up we have ear. Tympanic membrane and middle ear are important topics for ear, and in genetics we have Down syndrome and Klinefelter syndrome, which should be written, and a proper diagram should be made. We have 4 important ganglions in our syllabus, which are otic ganglion, ciliary ganglion, pterygomandibular ganglion, and then the submandibular ganglion. Thank you for watching this video. If you have any query, kindly comment down. Please like, share and subscribe to this video. Thank you so much.